United Lutheran Seminary presents the Seminary Explores podcast, conversations on faith, art, people, politics, theology, life, and more, with voices from around the corner and around the globe.
What could be more in the news these days than national health care? Hello, I'm Jerry Christensen, and this is the Seminary Explorers with Dr. Dwight Michael, who is a Gettysburg Family Practice practitioner and a member of Physicians for a National Health Care Program, or National Health Program, and also a board member of Healthcare for All Pennsylvania. He's been active for most of this past decade, besides conducting his own practice. And as you're going to be able to tell here in just a few moments, he is very much on top of the situation. Let us, instead of talking about details first, let's talk about some big issues. How do you feel about whether or not healthcare is a human right for everyone in our nation? Isn't that kind of the fundamental background of the whole thing?
Well, I think it is a fundamental question that we need to answer as a nation. I came to believe this about 10 years ago when I became active in promoting or advocating for improved Medicare for all. The first thing that changed my mind about this was watching Sick Around the World by T.R. Reid. So it's still available on frontlinepbs.org, but it was a great hour, maybe 75-minute program on T.R. Reid interviewing healthcare systems around the world. So he picked out 6 other nations. And they all do it a little bit differently, as we would do it if we went to a one-payer system. But they believe health care should be a human right, and they provide universal health care for all of their peoples. And I was thinking, geez, we spend twice as much per capita as any other nation on earth for health care, and yet we don't do that. Mm-hmm. And in fact, when I started to believe in this, we had about 50 million uninsured in our nation. The Affordable Care Act has reduced that, but obviously that's under great stress at this point, and if the powers that be have anything to do about it, will be repealed and replaced.
Yeah.
But we have to decide as a nation, should we make health care a human right? I strongly believe that it should be a human right. And
the nations you're mentioning are all industrialized nations, modern industrialized nations. They're not backward countries with struggling economies. It seems odd that we design ourselves as the strongest nation in the world, the most powerful, the most economically viable, etc., and yet we don't do this. If we had a better system in place, we could say, well, we can do better than others, which is probably what you want to do anyway, is do it better than others. But it doesn't seem to jibe with the way the world has been going.
I would agree with that. And we can provide health care for all Americans and still spend no more than what we're presently spending, possibly less. Mm-hmm. You know. Powers that be would have you believe otherwise, but I'd be happy to try to explain how this is possible.
Please do.
Presently, of every healthcare dollar, we spend at least 35% of that on administrative cost. 20% goes into the average amount that the insurance companies expects to collect out of that dollar for their overhead. As late as 1990, that was 5%. But they're not satisfied now with 20%. They fought tooth and nail for more than that during the negotiations for the Affordable Care Act. An additional 5 to 10% of that is on the health care provider side of administrative cost. So every physician in America at this point spends about $85,000 a year for administrative cost. That's for our cost to interact with the insurance industry. On top of that, you have the cost of pharmaceuticals in our nation, where we spend 60% more for our pharmaceuticals than any other nation on earth, because every other industrialized nation on earth negotiates drug prices per year with the pharmaceutical industry, and yet our present legislation still protects the pharmaceutical industry under the guise of capitalism and allows them to charge whatever they want, that the free market will take care of that. Which is a tremendous mem, or false belief. So that the free market doesn't take care of that. The free market allows the greedy to be as greedy as they want to be.
Mm-hmm. And what about the argument in that, just hooking onto the last one, the argument that we need that money to invest in research for further advances in drugs?
Studies show that they spend 10 to 14% a year on research and development. And studies also show that of all the new drugs released in the last so many years, a very minimal fraction of those come from that R&D money. So I truly believe that's been a false fact that they have presented, not that they aren't putting that much money into it, but that they need the profit they make from the American people to support their R&D. They spend 25% of their revenues on marketing and paying their CEOs and VPs, and that could be streamlined significantly.
Do we have any figures on what it currently costs or will cost in the next 10 years for what you have called single payer or universal health care, whatever name we're going to be giving it? Let's call it single payer. Do we have any idea about what that will cost the taxpayer and what we are now probably project will be paying under the current system in the next 10 years?
Okay. So an article, it was an op-ed from the Washington Post from July 6th, just yesterday. The author of this article had done some research, and at this point, the party in power is scaring off the American public and saying that a single-payer system would increase taxes over the next 10 years by $23 trillion. So right off the top, that's pretty frightening.
Yeah.
But they don't go on to say that projected costs for health care in America over the next 10 years is $39 trillion. So, the counter-argument would be that we can save the American public $16 trillion over the next 10 years if we transition to a single-payer system. Now, what many people don't take time to realize is at some point along the way, we all need health care. Unless you're a backwoodsman that says, I'm just going to let nature do its thing, I'm never ever going to go to a doctor, I'm never ever going to go to a hospital, I'm never ever going to ask for health care. If you want to do that, so be it, but not too many people are in that bucket.
No.
So we're all going to use health care. Presently, the average amount of health care, and this maybe goes back 2 or 3 years, is 8% of income goes towards health care. We believe that if the American public has to pay more than 10% for their health care, that is underinsurance. And that's where we're at right now with the Affordable Care Act. If we went to a single-payer system, whatever we pay in taxes would replace everything we now pay for premiums, health insurance premiums, for co-pays, for deductibles, for dental care, for eye care, for long-term care, for physical therapy, for occupational therapy, for addiction care, for mental health care. From $1, no co-pays, no deductibles. Now, that is what our state plan provides. And any plan that's started on will be changed over time. But we have an economic impact study that says we could do that with 3% personal income tax and 10% payroll tax across the state of Pennsylvania. The House bill present in the national legislature right now funds it a little bit differently, and Bernie Sanders' plan that he has not yet released will fund it yet a little bit differently. But as sure as I'm sitting here, for 99% of Americans that utilize healthcare or will utilize healthcare, it would be a dramatic savings in their total out-of-pocket cost. So if I can convince people who are listening to this podcast of nothing else, think not only about what you pay in taxes, think about out-of-pocket costs. What goes out of your pocket in a year's time for all of your expenses? And unless you're very, very rich, you will not pay more for your health care in a single payer system than we are presently paying and we will be paying in the years ahead.
We're talking to Dr. Dwight Michael about the whys and wherefores of single-payer universal health for all Americans, and I'd like to mention again that he is a practicing physician. He's not just a theoretician. He came right from the office for this interview and will be going back to work again tomorrow. He has, in his more recent years, been a member of Physicians for a National Health Program and a board member of Health Care for All Pennsylvania. So he has been putting his feet on the ground with his convictions. Well, we were asking Dwight, can we afford to do this? Maybe I can put it the other way around. Can we afford not to do this?
So for 8 years, we've heard that Obamacare is horrible and terrible, and if the party that won this past election won the election, they would repeal and replace Obamacare with something wonderful, something amazing, something dramatically better. Our presidential candidate has commented in his campaign that he would not allow our legislature to do away or harm Medicaid, Medicare, and Social Security. In any case, at this moment, we have the House of Representatives that's passed a bill that would undercut Medicaid to the point that within 10 years, 22 million people will have lost their health insurance. Furthermore, those of us in the age bracket of 55 to 65 will be allowed to be charged 5 times the base rate versus 3 times the base rate. And the Kaiser Family Foundation just came out and said by 2020, if the House bill or the Senate bill passes, those of us in that age bracket will be paying 72% more for our premiums. 2020. That's not very far in our future. As it is now, my wife and I pay $21,000 a year plus a $4,000 deductible for our present year's insurance. So there are a lot of things being thrown about right now, comments that I feel are terribly incomplete and misrepresentative of the truth.
Who would be covered? Who are we missing most of all in this current system?
So in the current system, I suspect some of these are actually the undocumented people in our nation. So that's probably up to 10 million, I believe. And then there are a few others that are still falling through the cracks. Although part of the problem with the Affordable Care Act was that all states were supposed to provide medical assistance to 1.38% of the federal poverty level. When the Supreme Court came out in 2012-14 range, and I'm not sure of the year, but when they came out with that decision, they allowed the states to make a decision as to whether they expanded Medicaid or not. And my understanding is 12 states eventually chose not to expand Medicaid. So those people that are caught in that dilemma of not being eligible for their medical assistance plan, which is different state by state, and that gap of 1.38% federal poverty level, they get nothing. They aren't protected at all. Mm-hmm. So it would have been even less uninsured if the Supreme Court ruling would not have occurred. And in fact, that's part of the unfairness of some of the claims being made by our politicians, is they're saying how medical assistance will it has increased cost, and yet part of the reason that the numbers are different is because those 12 states that didn't adapt have left the statisticians with the ability to say things like that.
Okay. Shifting a little bit, what is the best way to describe this program, the way you'd like to see it? And I know there is the Sanders Plan and there are plans by others. So you called it already single payer, but what about just using the term Medicare for all or improved Medicare for all? What do you think would work best to resolve the situation? Can a name do that, or is it really in the details?
I just saw a review on this. I've always felt that improved Medicare for all was the best way to term this plan. Medicare has been seen as a pretty good thing by all people who have Medicare. So it's a fairly favorable term to begin with. For many, many years, propaganda has been used against single payer. So I believe that many Americans, at least in the past, have had this mindset against single payer based on everything they read in the news. The latest poll, though, suggested that it's changing, that single payer no longer has the same negative connotation. In all honesty, it would be a one-payer system administered by the state, going back to what the insurance industry presently takes out of the bucket of healthcare, 20%. Medicare has run on 3% a year or less. So we would save $400 billion a year right off the bat in reducing that administrative cost of healthcare from 20% to 3%. So I say improve Medicare, because now Medicare folks have to, almost all of them, get a supplemental or an Advantage plan. If you notice, our latest Secretary of the CMS, Price, the representative,
Tom Price.
I just read that they're not going to release the data on what the Advantage plans have actually done for us. That's yet another piece of this whole pie. Medicare initially was Medicare and the classic supplemental plans. But then back around 1999, they allowed the private health insurance industry to show us how they could be more efficient. However, everything I've seen thus far suggests that they've not been more efficient. They've actually taken $1.15 for every dollar that has gone to the supplemental plans. So they've taken a little bit more of the taxpayer money to help themselves in the process. So more of the taxpayer dollar is going to enrich the private health insurance industry.
What are some of the resources besides this interview that people who are listening can turn to? Are there a couple of websites by Healthcare for All Pennsylvania and so on? Can we go to some, or books that are readily available?
Yes. So first, there are many websites. The two that I go to on a regular basis would be pnhp.org. physiciansfornationalhealthprogram.org. And so anyone is welcome to utilize that website. There's a wealth of information about why we believe that improved Medicare for all is the only thing that we can afford in our future because of the escalating costs of healthcare otherwise, and that would provide healthcare for all Americans. Secondly, our state website. So as of 2017, the states are allowed to experiment with the Affordable Care Act if it would be kept in existence, as long as they provide as much as the Affordable Care Act presently provides for its patients. And that website is healthcare, as one word, HEALTHCARE, and the digit 4, all, ALLPA, .org.
Okay.
And that allows you to look at our bill that will be released in the very near future. Our representative, Pam Delicio, has waited till the number came up on the agenda before she reinstates it for this 2-year interval or the 2-year docket.
So it will be considered.
Right. And there's also an economic impact study from 2014 on the website that's available to read as to why we think this is doable from a financial standpoint.
We've been talking today to Dr. Dwight Michael, a Gettysburg family practitioner in Gettysburg Family Practice, as a matter of fact. He's a physician for a National Health Program member and a board member of Health Care for All Pennsylvania. We've been talking about the whys and wherefores of national health. I'm Jerry Christensen for the Seminary Explorers. Have a very good day.
You have been listening to The Seminary Explorers, a production of United Lutheran Seminary with campuses in Gettysburg, Pennsylvania and Philadelphia, Pennsylvania. We invite you to visit our website at unitedlutheranseminary.edu. All opinions expressed on this program are not necessarily those of United Lutheran Seminary or the Evangelical Lutheran Church in America.